Back in 2003, Mooney was found guilty of using the banned diuretic coamilazide and received a 1-year ban from competitive cricket. He claimed that the amiloride and hydrochlorothiazide combination drug was given to him by his mother for aesthetic purposes, rather than to treat a pre-existing injury or to mask other substance abuse. Since then, many more athletes from varying sports have used this class of drugs to enhance performance. Diuretics are designed to increase urine production and sodium excretion in order to help treat diseases such as hypertension, heart and renal failure, and lung, kidney, and liver diseases. WADA and the International Olympic Committee first banned these substances in 1988 after it became apparent that athletes could use diuretics for competitive advantage. Diuretics can be used in two major ways to alter performance. Directly, diuretics' ability to reduce salt and water retention allows for a quick reduction in weight loss, a capability that could be crucial for meeting weight categories. Athletes in martial arts, boxing, weightlifting, wrestling, gymnastics, and horse racing all gain advantage by being lighter, either in competition or weigh-in day. Indirectly, diuretics are also used to mask other substance abuse. The high production of urination and thus excretion of substances means that athletes can be clear of any substance abuse by the time they are tested. While not as common, some diuretics, such as acetazolamide, can also help reduce high-altitude mountain sickness, used by mountain skiers and climbers. In 2013, the World Anti-Doping Agency released their annual anti-doping testing figures laboratory report. They ranked diuretics as the third most abused drug class for competitive sports, accounting for 7.5% of all doping cases, with 393 individual instances. Of the abused diuretics, furosemide and hydrochlorothiazide are the most popular, with 36 and 31% abuse respectively within the diuretics class.
So what makes these two diuretics so popular to cheating in sport? Fast mechanisms of action, paired with fast half-lives, make them ideal for this use, as the body makes use of them and disposes them fast enough that tests are unlikely to pick them up unless done soon after administration. Furosemide is a loop diuretic, named so because it acts on the ascending limb of the loop of Henle. It binds competitively to the chloride binding site of the sodium-potassium chloride cotransporter, meaning that rather than sodium being reabsorbed into the basolateral interstitium, it flows on through to the collecting duct. As the ascending loop is responsible for a quarter of sodium reabsorption, furosemide is a highly potent diuretic. Toxic effects of the diuretic through misuse or overdose may cause fluid and electrolyte depletion, and diffuse excessively rapid weight loss, which is unfortunately sometimes the goal behind its use. Other effects are gout, orthostatic hypertension, acute hypotensive episodes, tinnitus, and reversible or permanent hearing loss and deafness. Hydrochlorothiazide is a thiazide diuretic. It acts further along the nephron at the distal convoluted tubule, inhibiting the sodium chloride symporter, which is responsible for 5% of sodium reabsorption. By blocking the symporter and restricting the presence of sodium in the cells around the distal convoluted tubule, it reduces the osmotic gradient and thus water reabsorption throughout the nephron. As thiazide diuretics are less potent than loop diuretics, the side effects tend to be less severe and less common. The most common observed side effects are electrolyte depletion, and in rare cases, gout and erectile dysfunction are also seen. It's also contraindicated by digitalis, as its combination with hypokalemia can cause cardiac arrhythmias. Paired with strenuous exercise, the fluid and electrolyte depletion can be severely taxing on the athlete's body. As the diuretics interfere with blood volume, hypertensive episodes may occur during performance-intensive tasks, which at the very least can cause dizziness and fainting, if not more serious problems.
The World Anti-Doping Agency has stringent anti-doping methods in place in order to catch athletes who use banned diuretics. Testing is achieved through random urine samples, and there are strict procedures surrounding collection. So next time you plan on cheating, make sure you hide it better than this.
And here we go. Sorry.
Yes, terrific.